Hello doctors, today we will be discussing forces in the dental materials. So there are 5 types of important forces, or more aptly stresses, that we shall be discussing today. First is the compressive stress. Second is the tensile stress. Now these two stresses are the axial stresses. Then we have shear stress. Fourth is flexure, and fifth one is the torsional stress. First of all, we will discuss the compressive stress. When compressive forces are applied on a body, they tend to compress the body. Internal resistance that is developed by the body is known as the compressive stress in this case. Then we have the tensile stress. Here the forces are applied in such a way that load tends to stretch or elongate the body. So for enlarging the body, how many sets of the forces are required? Yes, 2 sets of the forces directed away from each other in a straight line are required. So now remember students, many of your dental materials are strong but brittle, for example ceramics. Now these tensile strengths can harm the brittle materials more than the compressive stresses here. The third stress that I want to discuss is the shear stress. Here we need 2 sets of the forces that are directed parallel to each other but not along the straight line. Here we are using combination of the forces, compressive and tensile. If you look at this figure, at the atomic level, 2 forces are anti-parallel to each other and they tend to break the bonds between the atoms. Up to a limit, there can be an elastic strain developed in the body, but beyond a level, if the forces keep increasing, then there will be plastic strain leading to permanent deformation of the body. A very famous example of shear force is the debonding of the orthodontic brackets. If you use a sharp instrument, if you put a sharp instrument parallel to the long axis of the tooth at the cement and tooth junction, that leads to the debonding of orthodontic bracket, which is a perfect example of this force. The fourth stress that we should discuss is the flexure. Flexure is basically a bending stress. Try bending a rod that will show compression and elongation at bend end. Inner bend compresses, leading to the shortening, and outer surface of the bend elongates, leading to the elongation. As we know, compression is caused by compressive stress and elongation is caused by tensile stress. So we can conclude in flexure there will be both compressive and tensile components. Also there will be a third component of shear stress, but it is not very significant in terms of dental materials. So in case of these stresses,